Did you know that a single blood test contains more data points than the entire Apollo 11 mission? Yet most of us glance at those numbers and feel completely lost, handing over our health literacy to medical professionals who often don't have time to explain what everything means. Your blood test results don't need to be mysterious codes written in a foreign language. Understanding basic medical test results is one of the most empowering skills you can develop for your health journey. When you can interpret your own numbers, you become an active participant in your healthcare rather than a passive recipient. Medical tests measure various biomarkers that indicate how well your body is functioning. These include blood counts that carry oxygen and fight infection, cholesterol levels that measure heart health, blood sugar indicating diabetes risk, liver enzymes showing liver function, and kidney function measuring how well your kidneys filter waste. Each of these measurements has a normal range established through large population studies. But here's where it gets interesting: these ranges represent where 95% of healthy people fall, not necessarily where you should be individually. When you see a test result, you'll typically see your actual value, the reference range, and sometimes flags for high or low results. But being normal doesn't always mean optimal. For example, your blood pressure might be normal at 130/80, but research shows that below 120/80 is even better for long-term cardiovascular health. Here's a trendy question that might change how you think about your numbers. If your cholesterol level is 200 mg per deciliter and the recommended maximum is 200 mg per deciliter, what percentage are you at your limit? And how much would you need to reduce it to be 20% below the recommended maximum? The answer is surprisingly simple. Yet many people get confused. You're exactly at 100% of your limit. 200 divided by 200 is equal to 1.0 or 100%. To be 20% below, you'd need to be at 160 mg per deciliter. 200 times 0.8 is equal to 160. This calculation shows why small changes can make a big difference. Just a 20% reduction in cholesterol can move you from optimal to ideal. Not all test deviations require immediate action. Look for consistent patterns over time, values outside the normal range by significant margins, and multiple related tests showing similar trends. Always discuss abnormal results with your healthcare provider, but being informed means you can ask better questions and understand their recommendations. Understanding your test results helps you make lifestyle changes that actually impact your numbers. Ask informed questions at doctor appointments. Recognize patterns that might indicate developing issues, and feel more in control of your health journey. Remember, medical tests are tools, not absolute truths. They provide snapshots of your health at specific moments and should be interpreted in the context of your overall health, lifestyle, and medical history. The next time you get blood work, don't just file it away. Take a few minutes to understand what those numbers mean for you. Your health literacy is one of the most valuable investments you can make in your future well-being.